You're tuning into the deep dive, and you're here because, well, you want the smart scoop without getting buried in jargon. We get it.
We absolutely do.
Today, we're diving into something that affects quite a few cats and their owners, feline lower airway disease.
Exactly. We've looked at a bunch of veterinary sources to really get to grips with this. It's a common issue affecting basically the lower parts of the cat's breathing system.
Lungs, the airways down there.
Precisely. The tubes carrying air into the lungs.
Okay, let's unpack this. Because one thing that jumps out straight away from the sources is, wow, the number of different names. Feline lower airway disease, or LAD. But then you hear feline asthma, bronchial asthma, allergic asthma, even chronic bronchitis, or just bronchial disease. It's kind of confusing.
It really can be. And honestly, that's kind of our goal today. We want to dig into these sources and bring some clarity. What is feline LAD? What's the difference, crucially, between feline asthma and chronic bronchitis?
Right, because understanding that difference seems key. So we'll be looking at definitions, how vets classify it, what might cause it.
How it actually affects the cats, and, how it's diagnosed.
Yeah, basically giving you the essential info. And it's relevant, too. The sources suggest maybe 1% of all cats are affected. That's quite a lot of cats.
It is. It's a significant number. So let's start right at the beginning. What exactly is feline lower airway disease?
As we kind of hinted, it's really an umbrella term, isn't it?
It is. It covers a group of conditions affecting that lower respiratory tract.
And importantly, there isn't one single definition everyone agrees on in veterinary medicine.
No, which is exactly why you see all those terms floating around. Feline asthma, bronchial asthma, allergic asthma, bronchial disease, chronic bronchitis.
Different vets or different articles might use them slightly differently, which, yeah, can definitely muddy the waters if you're trying to understand what's wrong with your cat.
Definitely. So to try and organize this, our sources generally break LAD down into two main categories.
Okay, two main types. What are they?
Asthma and chronic bronchitis.
Right. Asthma and chronic bronchitis. So what's the fundamental difference there?
Well, feline asthma.
Yeah.
It's often characterized by reversible bronchoconstriction.
Reversible meaning?
Meaning the airways narrow down, but crucially, they can open back up again. And the inflammation associated with it tends to be dominated by a specific type of white blood cell, the eosinophil.
Eosinophils. Okay. So airways narrow but can relax, and these eosinophil cells are involved. What about chronic bronchitis then?
Chronic bronchitis, on the other hand, is usually linked to inflammation, where neutrophils are the main players.
Huh.
Another type of white blood cell.
Neutrophils attack.
And generally, the airway obstruction in bronchitis is thought to be, well, less reversible.
Yeah.
More fixed, perhaps.
That reversibility point seems really important. So asthma can potentially get better quickly with treatment. Bronchitis maybe less so.
That's a key difference in
Okay.
how we think about them, yes. And it affects emergency treatment, too.
And the sources also mentioned chronic asthmatic bronchitis. It sounds like a mix.
Exactly. Some cats seem to have both types of inflammation, the eosinophils and the neutrophils.
How does that happen?
Well, the leading theory is it might start as allergic asthma, the eosinophilic kind. But that ongoing inflammation causes damage.
Which then leads to the other type of inflammation kicking in, the neutrophilic kind.
That's the idea. The initial allergic damage paves the way for the bronchitis picture to develop alongside it.
Interesting. So even if, the symptoms look similar day to day and maybe current management isn't drastically different,
Right.
understanding these underlying cellular differences is really important for developing better, more targeted treatments in the future.
Absolutely. That's where a lot of research is heading. Knowing why the airway is inflamed could lead to much more specific therapies down the line.
Makes sense. Okay, so who gets this? Are certain cats more prone to LAD?
The sources do point to some predispositions. Breed seems to be one factor.
Oh, which breeds?
Siamese cats are consistently mentioned. They seem to have a higher risk, maybe up to 5% prevalence in the breed.
5%? Wow, compared to the 1% overall, that's quite a jump.
It is significantly higher, yeah.
What about male versus female cats? Any difference there?
That's where it gets a bit unclear. Some sources say no real difference. Others suggest females might be slightly more affected.
Huh. So the jury's still out on that one.
Seems like it. It's interesting, isn't it, when sources disagree?
Yeah, why might that happen? Different study groups, maybe?
Could be. Or different ways they defined or diagnosed the conditions in various studies. Maybe even subtle hormonal things we don't fully grasp yet.
Possible. Okay, what about age? When does this usually show up?
Asthma typically develops in younger to middle-aged cats. The average age mentioned is around 4 years old.
4 years. But there's a range.
Oh yeah, quite a wide one, from as young as 1 year up to maybe 15 years old.
So it can happen across most of a cat's adult life. But what if, say, an older cat suddenly has a really bad asthma attack? Does that mean it just started?
Not necessarily. That's a great point. The sources suggest that even if the first severe crisis happens later in life, there's often a history, maybe of intermittent coughing.
That maybe the owner didn't think much of.
Exactly. A quiet cough now and then might indicate the underlying condition has been brewing for a while.
Right. The big attack is just when it finally gets really bad. Okay, let's dig into the why. What actually causes LAD?
For feline asthma, the consensus is pretty strong. It's primarily an allergic disease.
Allergies. Like humans get hay fever.
Very similar concept, yes. It's thought to be triggered by things the cat inhales aeroallergens.
What kind of things?
The common culprits mentioned are house dust mites, Bermuda, grass pollen, other types of pollens, stuff floating in the air, basically.
Indoor and outdoor triggers, then. Anything else contribute?
Well, there are a couple of other interesting associations. Living in a city environment seems linked to a higher incidence compared to rural areas.
Really? City living? Why would that be? More pollution.
That's the suspicion. Maybe higher levels of pollutants, or maybe just different types of allergens concentrated in urban areas.
And I think I saw something about smoking.
Yes. Though it's mentioned more anecdotally, there's a suggestion that living in a smoking household might be a contributing factor too.
Okay, so irritants and allergens are big for asthma. What about chronic bronchitis? Is that allergies too?
Not usually, no. The thinking there is it's more likely a result of previous damage to the airways.
Damage from what?
Maybe a past infection that didn't clear perfectly, or perhaps inhaling irritants, chemical fumes, smoke, that sort of thing that caused lasting injury.
So less of an ongoing reaction, more like scarring or lasting change from something that happened before.
That's the general idea.
And how does that fit with the chronic asthmatic bronchitis again? The mix.
Well, tying it together, the theory is it starts as allergic asthma, right? With the eosinophils causing inflammation. But over time, that constant inflammation damages the airway walls. And that damage then triggers the neutrophilic inflammation we associate with chronic bronchitis to develop on top of the asthma.
So one can kind of lead into the other, potentially.
Potentially, yes. It could represent a progression in some cats.
It's complex how these things interact. Let's get into the weeds a bit on asthma's mechanics. You said it's like human allergic asthma.
The proposed mechanism is very similar, yes. It starts with breathing in those allergens.
Yeast, mites, pollen.
Right. In a cat that's susceptible, this triggers what's called a type I hypersensitivity reaction.
Type I. That sounds fast.
It is. It's an immediate allergic overreaction. The immune system kind of shifts gear. It leans towards what are called T helper 2 lymphocytes.
Okay, T helper 2. What does that do?
That pathway drives the allergic response. It leads to the production of specific inflammatory chemicals or mediators, and it also tends to suppress the other side of the immune response, the T helper 1 side, which would normally help keep things in check.
So the allergy part of the immune system gets overactive.
You could put it that way, yes. An imbalance.
And what do these inflammatory mediators actually do in the airways?
They do several things. They stimulate the production of IgE antibodies, the allergy antibodies, and they attract those eosinophils into the airway walls. That's your hallmark eosinophilic inflammation.
Right. Which causes?
That inflammation contributes to airway hyperreactivity, making the airways twitchy and overly sensitive, and over time, it can even lead to physical changes in the airway structure called remodeling.
Wow, so inflammation, sensitivity, even structural changes. What else?
They also ramp up mucus production, so you get excess mucus in the airways.
Sticky stuff, clogging things up.
Exactly. And they directly cause the smooth muscles wrapped around the airways to contract. That's bronchoconstriction. Substances like histamine, released from eosinophils and mast cells, are key players here.
Okay, so inflammation, swelling of walls, extra mucus filling the space, and muscles squeezing the tubes shut.
That's the trifecta, yes. It all leads to airway narrowing and difficulty moving air.
Which we see as coughing and wheezing.
Precisely. And during a bad asthma attack, that bronchoconstriction part can happen really fast and severely restrict airflow, causing serious breathing distress.
Scary stuff. Now, the sources mention something about a balance between things that constrict airways and things that open them up.
Yes, the airways are normally under the influence of systems that cause constriction, mainly the parasympathetic nervous system.
Okay.
And systems that cause dilation, or opening the sympathetic nervous system, plus other factors like nitric oxide. It's a constant balancing act.
And in asthma, this balance is off.
It's thought that the balance shifts towards constriction. But, and this is the crucial bit for asthma, that constriction is generally reversible.
Ah, back to the reversibility.
Yes. With treatment, like bronchodilator drugs, or by removing the allergen, those airways can open up again.
That's a really hopeful aspect of asthma, isn't it? Okay, let's switch gears. What does this actually look like to a cat owner? What signs should they watch for?
Well, cats with LED can show a huge range of signs. It can be anything from just a chronic cough.
To a full-blown breathing crisis.
Exactly. A real spectrum.
Tell me about the chronic cough. What's typical?
It might be intermittent, happen sometimes, but not others. Or it could be multiple times a day. A key thing is that often, between coughing fits, the cat seems perfectly normal.
Which might make owners think it's not serious.
It can't, yes. They cough, then 5 minutes later they're playing or sleeping, seeming fine.
And the acute breathing distress, what are the red flags?
Well, if a cat has that history of chronic coughing, that's already a clue. It might be asthma if they suddenly worsen. Signs of distress can include really obvious difficulty breathing, maybe using their belly muscles to push air out.
An expiratory push, they call it?
Yes. Sometimes you hear an actual grunt when they breathe out. They might breathe with their mouth open, which is always serious in cats.
Definitely.
Or they might adopt an orthopneic stance, refusing to lie down, maybe crouching with their neck extended, trying to keep their airway straight.
Trying to make it easier to breathe. Any other signs? Seasonal patterns?
Yes, some owners notice the cough is worse at certain times of the year. And another interesting one is vomiting right after coughing.
Vomiting after coughing. Why is that?
The forceful coughing can sometimes trigger a gag reflex, it seems.
Got it. Now, you mentioned earlier this huge misconception, the hairball thing.
Yes. This is so important. So many owners see their cat hacking and crouching and just assume, oh, hairball.
But it's not the same.
Absolutely not. Coughing comes from the lungs, the lower airways. Retching or gagging to bring up a hairball comes from the stomach or esophagus. They can look similar to the untrained eye, but they're completely different processes.
And confusing them means people might ignore a serious cough.
Exactly. They think it's normal, just a hairball thing, and they delay going to the vet, sometimes for a long time, while the underlying airway disease gets worse.
That's a really critical point for listeners. Don't automatically assume hacking is a hairball. Okay, so a cat comes into the vet. What might the vet find on examination?
It really varies. Depends how long it's been going on, how severe it is right now.
What about with chronic bronchitis?
With bronchitis, if it's mild or stable, the cat might actually seem totally normal on exam. But if they're having a flare-up, you might see that increased breathing rate to dyspnea or obvious difficulty breathing, dyspnea.
And for asthma, are there more specific signs?
Often, yes. The classic finding is that expiratory dyspnea, more trouble breathing out than in.
The expiratory push or grunt you mentioned?
Right. Open mouth breathing, the orthopneic stance. Those are signs of severe distress in general. When listening to the chest with a stethoscope.
Auscultation.
Yes, auscultation. You might hear crackles or wheezes. Those wheezes, that whistling sound, are really characteristic of narrowed airways in asthma.
Makes sense, like air forced through a tight tube. So a cat comes in struggling to breathe. What's the first step?
Stabilize first, ask questions later, essentially. A quick initial assessment. How severe is the distress? Maybe check oxygen levels with a pulse oximeter.
Little clip on the ear or pop.
Exactly. If the cat's in severe distress, the priority is oxygen therapy, maybe an oxygen cage, and minimal stress. Handle them as little as possible.
And medication.
Often, yes. An injectable bronchodilator to try and quickly open the airways.
And if the vet strongly suspects asthma right then?
In an emergency, they might also give an injectable corticosteroid, a fast-acting anti-inflammatory.
Even before they have a firm diagnosis?
Yes, because if the cat rapidly improves with those treatments,
that strongly points towards asthma.
It does. That quick, positive response is a very strong indicator.
Okay, once the cat is stable, what about diagnostics, like x-rays?
Chest x-rays or thoracic radiographs are usually the next step. They can provide really valuable clues.
What kind of clues point towards asthma on an x-ray?
You might see what's called a bronchial pattern. The walls of the airways look thickened. On the image, this can look like little circles or donuts if you see the airway end on.
Okay.
Or parallel tram lines if you see it side on. Sometimes there's also an interstitial pattern, meaning the lung tissue itself looks a bit hazy.
So, thickened airways, hazy lungs, anything else?
Another common finding is hyperinflation, air trapping.
Meaning the air gets in, but can't get out easily.
Right. On the x-ray, the lungs might look unusually large and dark. Maybe the diaphragm looks flattened because the lungs are pushing down on it.
Any less common findings?
Occasionally, you might see that the right middle lung lobe has collapsed. Or rarely, air outside the lungs and pneumothorax. Even rib fractures have been reported, maybe from forceful coughing, sometimes a patchy alveolar pattern suggesting fluid in the air sacs.
Sounds like x-rays can show quite a bit, but what if they look normal?
And this is absolutely key. Normal chest x-rays do not rule out lower airway disease.
Really? So a cat can have asthma or bronchitis but have clear x-rays?
Absolutely. Especially in milder cases or between flare-ups, the changes might just not be visible on a standard x-ray.
But they're still important to do.
Definitely. Because they're crucial for ruling out other things that can cause similar signs, like congestive heart failure or maybe even cancer in the chest. You need to check for those possibilities.
Right. And the sources mentioned that coughing isn't actually that common in cats with heart failure.
Generally, no. Coughing is much more typical of primary respiratory disease like LAD in cats. Heart failure might show other signs, a low body temperature, a really fast or slow heart rate, maybe a heart murmur or a gallop rhythm when listening to the chest.
Okay, so x-rays help rule things out, might show suggestive signs but aren't definitive on their own. What is the definitive test then? The gold standard?
The gold standard, according to our sources, is lower airway cytology.
Cytology, looking at the cells.
Exactly. You need to get a sample of the cells lining the lower airways and examine them under a microscope.
How do you get that sample? Sounds tricky.
There are two main ways: an endotracheal wash, or more commonly a bronchoalveolar lavage, or BAL.
BAL.
Yes, it involves putting a small amount of sterile saline fluid down into the airways and then suctioning it back out. That fluid picks up cells and mucus.
Can you do that easily?
It usually requires sedation or light anesthesia. It can be done blindly, just passing a sterile catheter down the breathing tube, or using a bronchoscope, a tiny camera, to guide the procedure and see where you're sampling. The blind BAL is probably more common in general practice.
Okay, so you collect this fluid sample, then what?
It gets sent to the lab. They'll do the cytology look at the cell types. It's also really important to send some for bacterial culture and sensitivity testing.
To check for infection?
Yes, just in case bacteria are playing a role. And maybe testing for mycoplasma species too, another type of organism that can cause respiratory issues.
And what does the cytology tell you? How does it differentiate asthma and bronchitis?
This is where it gets really specific. For allergic asthma, you expect to see mostly eosinophils. The sources suggest finding more than about 17% eosinophils is pretty indicative.
Okay, lots of eosinophils, asthma. What about bronchitis?
For chronic bronchitis, the main cell type you'll see is the neutrophil. But importantly, they should look like healthy neutrophils, not the toxic neutrophils you see fighting off a nasty bacterial infection.
So neutrophils, bronchitis, and the mixed one, chronic asthmatic bronchitis.
You'd expect to see significant numbers of both eosinophils and neutrophils, a mixed inflammatory picture.
So the cytology really pins down the type of inflammation. That seems crucial. Any other tests usually recommended?
Yes, usually a good idea to run routine blood work, a complete blood count, or CBC, and a biochemistry profile.
What do those show?
Often they're actually normal in cats with LAD. Sometimes with asthma, you might see a higher number of eosinophils in the blood too, but not always.
Okay, what else?
Testing for viruses like FIV and feline immunodeficiency virus and feline leukemia virus is usually recommended.
Why those?
Especially if the cat goes outside or lives with other cats. These viruses can affect the immune system and potentially the prognosis or response to treatment.
Makes sense. Any parasite checks?
Yes. A Behrman fecal test is often done to look for lungworm larvae. Lungworm can definitely mimic LAD signs.
Lungworm, okay. And heartworm. I thought that was more of a dog thing.
Cats get heartworm too, and it often presents with respiratory signs, confusingly enough. So heartworm antigen and antibody testing is routinely recommended for cats with coughing or breathing issues.
Antigen and antibody. What's the difference?
The antigen test usually detects adult female worms. The antibody test shows if the cat's immune system has ever reacted to heartworms, it can stay positive even after the worms die. A positive antibody test with the right signs can suggest an active infection. Even with young worms, the antigen test might miss.
Wow, okay, so it's a pretty comprehensive workup. Blood tests, virus tests, parasite checks, maybe heartworm tests, all leading up to potentially that airway sampling for cytology.
It is. It's about building a complete picture and ruling out other possibilities to get to the right diagnosis. Because as we've said, even though asthma and bronchitis might cause similar signs like coughing,
Knowing which one it is, based on that inflammation type, is really key for deciding on the best management.
Exactly. Understanding the underlying pathology is crucial for effective treatment.
And treatment. Well, that sounds like a whole other deep dive. Our sources actually mention a part 2 focusing on management.
And do they do? Something for us to tackle in the future, perhaps.
Definitely. But wrapping up this dive into diagnosis, the big takeaway seems to be feline lower airway disease is common. It mainly falls into asthma or chronic bronchitis.
Each with different inflammatory cells driving them and different potential causes.
And while signs and x-rays give clues, that airway cytology is often needed to really know for sure which type you're dealing with.
Precisely. And that distinction matters for how we approach helping these cats feel better. That reversibility in asthma is a key factor.
Absolutely. So maybe a final thought for everyone listening. Really watch your cats. Notice those subtle changes, that seemingly minor cough.
Yeah, don't just brush it off as, oh, just a hairball. If it's persistent, get it checked out by your vet.
Because catching lower airway disease early, getting that accurate diagnosis, it really makes a difference in keeping them comfortable and improving their quality of life.
It really does. Definitely explore the resources we talked about if you're interested. And always, always talk to your own vet if you have any worries about your cat's breathing.